what advice would you offer providers, practitioners who are thinking about using AI? What should they be keeping an eye out for as they look into AI in their practices?
Sure. So I do think that there's some pretty nice policy, right, that came out from the White House most recently. There's also APA has the mental health advisory or mental health tech advisory group, right? So they're putting out blog posts on a regular basis. I also would highly recommend Therapists in Tech as a community and resource for people to learn more about different ways that technology is working out in the field of mental health. I know that there are other like policy groups like Meadows as one, right, that are trying to put out guidelines and give policy support to folks. But I think in addition to that, I would really look up the website of the tool, and I would try to figure out, is there a clinician involved, right? Do they align with like AI principles around ethics? I would also check to see that if the tool you want to use is HIPAA compliant, right? Like there are some checks and balances, right? There will be more in the years to come, but there are some now. And so I think the HIPAA compliance, making sure that a clinician is involved, and then looking for some of the policy guidelines that are coming out from different groups that are really in the know. And they're very current, right? Like these are things that are coming out every couple of months. So I would do my best to stay abreast of that kind of information too.